Those of us here at Colorado State University are proud to share with you this session of Endoscopy Talks. When you're looking for inspiring veterinary CE experiences, think CSU Vet CE. Nestled up against the Rocky Mountains in our new State of the Future facility, we invite you to experience what we call CE Elevated. We'd love to see you in one of our future on-site, online, or blended courses. Check us out at www.csuvetse.com. Now, please enjoy Endoscopy Talks.
Hello, everyone, and welcome to Endoscopy Talks. I'm David Tweed with Colorado State University and the Translational Medicine Institute. Today, we're joined by Dennis Chu, Professor Emeritus from Ohio State University. Now, Dennis has been a very good friend of mine since we were resident mates together at the Animal Medical Center in New York, where Dennis chose the pathway of nephrology and urology during his residency. He's a diplomat of ACVIM and was faculty at Ohio State University for 36 years. He's authored hundreds of publications as well as 2 editions of Nephrology, Urology, and Small Animals. He was one of the first to perform and promote diagnostic urinary endoscopy in small animals. And coupled with his interest in feline interstitial cystitis, he is no doubt, or at least who I would consider the world's expert in feline cystoscopy. And today he will present cystoscopy in cats, and he'll tell us that yes, we can do this. So without further delay, Dennis, I'll turn it over to you.
Thanks for that nice introduction, David, and on with the show. So it's always surprised me that veterinarians are suddenly now getting interested in scoping cats. We've had the ability to do it for a long time, but the timing seems to be right. And so I'm here to help us get a little bit more excited about how we might be able to do that. There's not a lot specifically written, particularly directed toward cats. Most of it's been directed toward dogs. I did a chapter in the urology nephrology manual for the SVNU several years ago with Julie Byron. There is some information there. There's a 2021 edition of Tim McCarthy's book on endoscopy, and there's a massive chapter on cystoscopy in there that has an extremely, a lot of information you might want to take a look at. Something that we wrote out of Ohio State many years ago is still very current with the content about how to do cystoscopy in cats. The pictures are in black and white and they're not very good. So hopefully the pictures tonight will make up for that 1996 veterinary clinics. As I've noted over the years, and I think many people would probably agree that cystoscopy is one of the most underutilized methods that we have of endoscopy going. And it's pretty easy to do. It's fast, it's accurate. You get all kinds of interesting and valuable results. And you can get not only a diagnosis, but you might be able to have a little bit of an intervention. We're not going to focus on interventions tonight. We're mostly going to focus on diagnostics. So where does this uroendoscopy or cystoscopy and urethrooscopy fit into the scheme? You know, we don't jump to it necessarily right away, although we could. It's usually an amalgam in between things with contrast radiography, ultrasound, surgery, and some other special diagnostic techniques on how the bladder and urethra might be working. I mean, if animals have an obvious chronic problem that's going on with incontinence, certainly we'd want to take a look at that. That's more important in dogs. Pollakiuria, hematuria, obstruction, cats certainly get that. Urogenital bleeding, every so often we would want to do that type of thing. Straining, certainly the cats that have idiopathic cystitis, they get stones, they occasionally get infections, not too often. Masses, chronic cystitis, whether it's sterile or bacterial, mostly sterile in the cat. And even after trauma, taking a look inside the bladder can be a useful thing. The conventional wisdom has been to think about endoscopy or cystoscopy after you've looked at every other type of modality. It's definitely the gold standard for diagnosing and staging ectopic ureter, at least in female dogs. I think it also has an amazing ability to determine the extent of disease in cancer of the bladder and urethra. The other modalities for imaging vastly underestimate the tumor mass. Idiopathic cystitis, I'm going to show you quite a bit of slides on that here tonight. Avoiding urohydropulsion, getting rid of stones and knowing how many were there before and after you did it. And every so often we get stuck not being able to place a urinary catheter. And so just passing a little scope up there to get a little better idea about how that urethral orifice is laying out there will help us get that catheter in. I'm not going to spend too much time on the exact equipment. Obviously, we need a light cable, a source of light, some type of video monitoring system. We need infusion lines. We need a capture system. We need telescopes and sheaths and that kind of thing. If you're going to be doing a lot of cystoscopy, this chair is delightful. It swings around so you can rest your arms on it while you're setting up at the operating table. We have a variety of different types of scopes. We have flexible ones that will be for our smaller patients or maybe our medium-sized animals too at times. We have rigid scopes for dogs. We've used the human pediatric one for a long time, and now the multi-purpose rigid also. So yeah, you need to have the right scope. This, see if I can pull up this laser pointer here. I mean, this is one we'd use for, dogs. This might be used for a medium-sized dog. These two smaller ones could easily be used for cats. And this is the one that we've used for cats in a very long time. It's a one-piece unit. The sheath is not separate from it. And there are a variety of different types of flexible endoscopes, usually derived from the human field for ureteroscopy. Some of you might have the MPR, the multi-purpose rigid telescope and the sheath that goes with it. This is probably going to be too big for most of our cats. If you have a really big cat, it might fit in there. There are a variety of different sheaths that you can put on the multi-purpose. The operating sheath is the one that gives you the biggest view and the most options for operating and infusing and draining. Sometimes we will put a smaller sheath on, like the arthroscope sheath or the protector sheath, but you don't have the opportunity to see as much and to do as much. These are the instruments that I used when I was at Ohio State. We were doing a lot of research on cats. We used the one up top here the most. This is a one-piece human pediatric scope, and I think it's very similar to the mini multi-purpose scope that Storz is now advocating for veterinary medicine. It's smaller than the other pediatric one, which has a telescope that goes inside a sheath. So this one will fit almost all the cats. This one will fit some of have to be just a little bit larger. The multi-purpose, the mini multi-purpose rigid endoscope is very similar to the pediatric scopes that we used or have used for a long time. And some people think it's an advantage that there is no lip. One of the sheaths has a lip. This one does not have a lip on it, so it might be considered easier to get into the urethral orifice. I never found it to be a problem to have the lip to get into the urethral orifice, however. So here's a comparison of the pediatric cystoscope that we used with a lip in comparison for the female cats. And this is a 1.1 millimeter flexible scope that we used many years ago. It's no longer manufactured, 1.2 millimeters. For male cats, it's very helpful to have a stay suture system to pull the prepuce out so that the penis is stretched, a little caudal there, and then we are gloved up, and that way we can more easily advance the fiber optic device into the cat's penis. This looks like something out of Star Wars. It's basically just a clamp system that we put together that would hold some of the pieces so we wouldn't drop them, and I would be able to handle this part of the scope without having to deal with these other things. I'd have an operator here helping with the focusing and helping with infusing. Male scoping is a lot more difficult than it is to do the females, but it can be done. And here we are. Obviously, this picture is from a long time ago. I don't look like that anymore, but we have the clamp system set up, and we've got it going in here, so it's going up this cat. This cat's under heavy doses of tilazole. Storz has come up with a lot of more modern, high performance fiber optic scopes, and these are two of them here, the Flex X2S and the Flex SC. I'm not going to go into too much detail about them, but they are remarkable in their advances in the image quality and the flexibility of the scopes and the ability to maneuver them. At one time, we used this scope, the fiber optic scope, the fiber scope, 2.5 millimeter scope, and it did a pretty nice job too. I'm not absolutely certain if that's still sold or not. Chris, you'll have to help me with that. So the idea is to be able to do some things through the scope. So we use the largest scope that we can, and this would be our pediatric one with the sheath on it. And we're passing a biopsy instrument through it. And that can be accomplished relatively easily in most situations. We can get into cats that are usually larger than 3 kilograms with the pediatric size cystoscope. Male cats that have a perineal urethrostomy can also be scoped with these rigid scopes. The flexible scopes are commonly used, of course, in males. If we have one that's about 1.2 millimeters or so, we can use it in male cats. We can use the 2 millimeter flexible scopes in female cats if we cannot get the rigid scope in. Usually we try the rigid scope first, and then we would think about a flexible scope second if we cannot get the rigid scope in. And it's usually a good idea to have general anesthesia, inhalational anesthesia, so they're completely relaxed. I usually do this in lateral recumbency. If you're going to be doing interventions, you might, if you need to get access to the ureter, you'd probably want them in dorsal recumbency. I think it's a little easier to do it in lateral recumbency. We tape the table, the tail to the table. We clip and cleanse the area, and then we have sterile fluid that we're going to infuse, and we're going to visualize the anatomy as we advance the scope. Now here's a female cat that's been clipped, and the pediatric scope you can see is in place. And these are my hands. There's a camera on the end of it here, and there's a halogen light source here, a xenon, I believe, and it's sending an image to our monitor, and we'll watch as we advance the scope up the vestibule after we went through the vulva. So we go in through the vulva. In the female cats, obviously, we're going to be looking at the vestibule. We're going to try to identify the urethral orifice. We'll advance up the urethra. We get into the bladder. We take a look around at the ureters. Cats don't have as many vaginal interesting things as do dogs, but you can certainly take a look around there. We recommend doing that last because that's a more contaminated area. So we're going to look at the external urethral orifice. We're going to look at the urethra, try to describe things. We want to see if we can find both ureteral openings. We're going to look at all quadrants of the bladder and see if it's normal or if there are lesions. I like to have a bag of chilled sterile solution. You can do it at room temperature, but if they get a lot of hemorrhage, sometimes just turning on a little bit of cold infusion directly into the bladder will stop that bleeding, and it gives you a much greater view. So we're going to infuse under gravity the fluid from this lactated Ringer's bag, and we're going to flush and drain so we have a constant clear field. I know this is a picture of a dog. I didn't have a picture of a cat, but you want to pinch the vulva on the female so that there's a watertight seal as you pass the scope in there, so you get the greatest distension of the vestibule. The way these scopes work is quite interesting. Most of the scopes we use are angled. There are 0 angled ones, but most of the times we're using a 30-degree angled scope. And when you put your light source on here, the direction that the light source is pointing is where the angle is pointing. So in this example on the left here, it's pointing up, which means that as you advance here, that there's a 30-degree angle looking up. If you turn this whole system to the right, now it's looking to the left. That means that the 30-degree angle is looking to the left. And if you continue to turn it all the way upside down, it's going to be looking down. So you can get around and examine pretty easily almost everything in the bladder this way. It's important to be patient. You shouldn't force anything. In my early days, I did force something a little early on, and I perforated a vagina in a cat. And that was very upsetting to me, but the cat didn't seem to know it happened. So go slow. Remember that water is very powerful. The power of water will help you as it flows through the instrument. It will distend the tissues and will allow you to advance with little resistance. So when you're looking through your telescope and what's on the television screen or the monitor, remember you're having a view that's 30 degrees lifted up here. So you want to advance by looking at the bottom of the screen here, because that'll help you get a little bit better familiarity of where you're heading. So we're going to flush, and we're going to intermittently do this flush and drain and flush and drain. There's a certain art form to do this. Tim McCarthy sometimes takes the sheath out if he's using a device that has a sheath and lets the drainage happen maximally that way. Some of our cat devices will not have a sheath, so we wouldn't have that option. But we can certainly flush and drain as we need, which is frequent. I don't know if this is too early to have a break for questions or not, but I stuck this slide in here in case anybody is having questions about the equipment or the things that we might. I put 3 of these in here, so
Yeah.
we'll see.
Yeah, Dennis, there is one question, and that is, if I were to purchase a small rigid scope for cats, can I also use that in dogs?
You could use it in dogs if it's a small dog. If it's a larger, medium-sized dog, or certainly if it's a very large dog, the mini rigid is probably not going to be long enough. I mean, there are ways you can still get around. You can push the bladder back to the scope if it's a larger dog, but that's not optimal. I think in today's world, we really need 2 scopes, one for the larger dogs and one for the smaller dogs and cats.
Okay. And maybe you're going to cover this later, but what is the incidence of ectopic ureters in cats? You said that, you know, that's the way to diagnose it in dogs.
Yeah, it's next to 0. I published a case on ectopic ureters many years ago that is embarrassing to me because I now know that it's a normal variant of the anatomy, which I will show you during the scoping today. In the cat, the ureter seems to terminate in the proximal urethra until you distend the bladder. And when you distend the bladder, it pulls it into the trigone region. So some cats look like they have ectopic ureters if the bladder is not full. Ectopic ureters are reported. They happen very, very rarely, especially compared to the dog.
Yeah, okay. And one last question is, what size scope would you use for a male cat who does not have a PU?
You need something that's about the 1.2 millimeter thing. Storz has a semi-rigid scope that is, I think it's 1.2 or 1.3 or 1.4 millimeters that can work at times. If you're doing a lot of male cat work, if you're seeing a lot of block cats, it would be useful if we had a decent scope. Well, we haven't had the perfect scope yet.
Okay, thank you very much. That's it for now.
Okay. So just a brief review of the anatomy. As we pass the scope up here, we'll split the lips of the vulva. And it's not nearly as difficult an entry as it is into the dog because it's very close together. So you'll pass your scope up here and then go down the urethral orifice, marching down the urethra and eventually into the bladder. The ureter terminates in the cat very close to where the bladder begins. And so sometimes there's confusion that it might be ectopic, but it's not. So this is what you'll see when you pass the cystoscope for the cat into the vestibule and we start infusing fluid, we'll distend it. And we can see this is the urethral orifice, this is the urethral mound, and that vertical line there, you aim your scope right there and you will go into the urethra. This little hole up here is heading into the vagina. We have not maximally distended the vestibule. Another cat that has been distended, we can see again, here's the urethral papillae. We're going to aim our scope right here. And after we get more fluid in it, you can see that urethral papillae has been separated just a little bit. It's easier to see that is where your target is to get into that urethra. Now, once you're in the urethra, the cat has a very prominent dorsal ridge. It was originally called Chew's Ridge in the beginning because I didn't know what it was, but it's a normal part of the anatomy. And you can see as we're distending it here, this thing will flatten out once the bladder becomes completely full. But before the bladder is full, you'll be able to see that ridge, and that tells you you're in the dorsal location. We go a little bit further on down. This is the same patient, a little further craniad. We can still see the dorsal ridge. And if you get very close to the bladder, the black spot here is the bladder. These things that some people have called mammillary bodies, they look like breasts. But this is where the ureteral openings will be as we go just a little bit further. As the bladder fills up, these protrusions are pulled cranially and into the trigone area. It's very different than in the dog. So here we have that mammillary body, and as we get pushed just a little bit further forward, we can see the normal ureteral openings, and it looks like they're in the urethra, but they're really not. Once the bladder becomes full, that whole thing will pull cranial, and this will flatten out into the trigone. These are normal cats. This is I don't know why this one's so white. but you can see the proximal, what looks like the proximal urethra. Once the bladder gets filled, these will pull forward. This is the left ureter and this is the right ureter. This is a closer up of the left ureter. So we'll then advance into the bladder. This is all the normal stuff we're going to do first. And so we see folds in here because the bladder has not been filled adequately. And so once we usually evaluate the bladder after it's been distended, it's not a bad idea to look at it when it's filling up also. So here we have the bladder that has been distended, and you can see there's a little funky discoloration here, and then there's a deeper white here and a blue area here. That's because we're looking right through the bladder into the abdominal cavity, and those are the intestines on the other side. And so if the bladder is nice and thin, it's a normal thing to be able to see viscera on the other side. And the vessels are pretty straight here. Here's another normal cat that has a small number of straight vessels, not too many vessels. This would be considered normal vascularity for a normal cat, female cat. So for the male cat, it's not as easy. And we try to pull the penis as far back as we can because it has a little curlicue here that would make it very difficult to advance the fiber catheter scope if we don't pull it back. And here we have the penis pulled back. You can tell it's an intact tom because of all the barbs that are on here, but we pull that penis back as much as we can, and then we start advancing if we have a fiber optic line that can fit in there. Now this is from, the optics are, this is from many years ago. So the fiber optic pictures are not nearly as interesting or fun, but you can still learn something from them. You can still make diagnoses. And so this is a normal cat urethra here, and this is a little folded over on itself. This would be the area in another cat. That is the actual urethral opening. We're kind of sliding up on the wall of the urethra here. As we go a little further and we get a little bit more distension, that spot opens up into here, and you follow the spot and you advance your fiber optic line along there. It's not always so easy. It takes a little twisting of the scope to get it to go exactly where you want it to go. So in the vestibule or the vagina area, we're going to assess that anatomy. Lymphoid hyperplasia is a real big deal in dogs that have urinary tract infections or puppies that have puppy vaginitis. There's not a lot of lymphoid hyperplasia that happens in cats. We don't usually get up to the cervix. We don't pay that much attention to the vagina in the cat usually. We certainly do pay attention to the urethral meatus. The cat doesn't have all these septal remnants and hymens that a lot of dogs have that are normal or who have ectopic ureters or who have some other issues with incontinence. Cats don't seem to have these kinds of bands. So we're going to take a look at that external urethral orifice. We're going to follow the dorsal urethral ridge, and we're going to go on in to the bladder. Now, this experience that you have will vary greatly by how full the bladder is. Once the bladder is full, the urethra looks totally different. It flattens out all the folds, it flattens out the dorsal ridge. So I like to look at it before the bladder is completely filled because I think you are able to more easily see some lesions. It's a good idea to examine that urethra and the bladder as you're going in and as you're draining, because sometimes you will see something that you missed on the way in. And when you drain, the bladder becomes less full and you're able to see perhaps a larger area of the bladder that maybe you didn't see completely the first time around. Here's an interesting case that I had a number of years ago. It was a female cat that came in for chronic straining and dysuria. And we could have done a whole bunch of things, which we didn't do. I went right to scoping because the cat had had months and months of issues and been worked up by other veterinarians, and there was no answer. So we decided to cystoscope the animal. On the way in, you can see that there are these spots, and these are what we would call glomerulations, submucosal petechiations in the urethra. Now, the urethra is not oftentimes described by many people as part of the interstitial cystitis thing, but it's really a big part of it, certainly for the male and for the females. The females, maybe a third or at least 30%, 40% of them that have interstitial cystitis will have lesions in their urethra. And so I found these glomerulations and I thought she's just going to have bad interstitial cystitis. Well, she had more than that, because as I advanced further, you can see a membrane here, and I see a little hole in it. We get a little bit closer, and here's the dorsal ridge, and here's the dorsal ridge again, and we're getting right up on top of this little hole, and she's got a gigantic stricture. You think of strictures in males commonly. We don't think of it so often in females, but that's what she had. And in those days, we didn't do ballooning and we didn't have a lot of interventional tools. At least I didn't know how to do them. And so the cat was sent to surgery and it did very well. It had that thing resected. Here's a little bit of the video. It takes a moment to get into it here. Now, once you take still pictures, it looks really easy, but it's not always that easy to get the video going. So we're pulling back in the urethra here right now. I know today's technology, this would be a little nicer for the film, but I think you'll still get the idea. And again, we have to flush because it starts bleeding a little bit here. So we're going to infuse and drain, and we'll go back in again to get a better look. And it looks like I'm struggling to get back in the urethral orifice, and you just have to be patient and turn the scope a little bit. And sometimes it'll pop right back in. You say it's not happening? Well, it will happen here in a moment. Here we go. We're back in now. You can see the dorsal ridge to orient yourself, and we're heading back again to see that stricture. I was quite surprised. I didn't know that female cats could get a stricture like that. Really, I wasn't thinking about that at all. Here's a case that a former resident of mine, Felipe Galveo, he shared some slides with me, and he found a similar thing in a cat that was having chronic straining and difficulty urinating. And you can see from a distance here, there's something funky going on in the proximal urethra. As we get closer, you can see that there's a membrane and a couple of holes in it. And Felipe took a bouchonnage here and stuck it through the holes and used that instrument to peel away the membrane, and then eventually entered the bladder. And we can see some pretty serious looking submucosal petechiations. I think these are pretty remarkably large glomerulations. So here's a female cat that has interstitial cystitis, and we were mostly focusing on the bladder when we suddenly realized that a lot of these cats have lesions in their urethra. So here's her dorsal ridge, and here she's got a glomerulation here and here and here, and several of them along the way. The urethra is an unappreciated organ, I think, as part of this process in the female. We always think about it in the males, and it's very important in the male, of course. They don't always have glomerulations. In this scoping here, this cat has pretty darn serious urethritis, lots of hyperemia, and maybe there are some glomerulations in there, but a pretty angry looking urethra. A little further in, still getting that angry look, lots of hyperemia. This is with the male scope, and we get those moray lines with the older technology. This is a cat that has it's got a urethral stone. It's got a calcium oxalate stone stuck in there. We got a pretty good view of it with our 1.1 millimeter scope. This is a struvite stone that's stuck in another male. And in a third male here, we have a plug of something, which is either gag or pieces of tissue or something. We did a study with 10 blocked cats, and unfortunately the videotape got lost on that. But those blocked cats had all kinds of strange and wonderfully interesting lesions. They didn't usually have plugs as we classically think of them. Excuse me. This is a cat that had a bladder tumor, and on the way in to look at its bladder tumor, we discovered that, oh, by the way, she also has she has a urethral tumor. This is transitional cell tumor growing in the urethra. The black hole down here would be on our way into the bladder. Transitional cell carcinoma is vastly underestimated. If you do not scope the dog or the cat, you have really no idea just how much cancer there might be. So we're going to evaluate the bladder after it's fully distended. We're going to drain them, but we're going to keep the scope in there. We're going to take a look around as it drains. Sometimes we find more things. I think you have a better chance of seeing all the quadrants of the bladder if you evaluate during filling and during drainage. This bladder is not filled yet, but you can see the folds, and you might be able to see some small calculi if they were there. This bladder has yet to be filled also. Nothing to get real excited about yet. I showed you this one before with the see-through bladder with the intestines. This is a normal vascular pattern. There is no extra vessels here. They're not winding or tortuous, and there's no edema. If you overfill the bladder, sometimes the bladder is very sensitive. If it's a pathologic bladder, it may split and get these kind of cracks. That's not a good thing. That means that maybe your bag is too high off of the table if it's going in by gravity. So we want to avoid that for sure, because that makes the scoping experience a lot less. This was a cat that had interstitial cystitis, and just touching the bladder gently removed the gag. It scraped it away. And sometimes we get flakes of gag. The glycosaminoglycan layer will pop up. It looked like we were painting the bladder. It just barely touched the bladder, and it got all this hemorrhage in here. So this is an exaggerated form of friability. And friability is a big part of what happens in cats that have interstitial cystitis. Now, are these things glomerulations? Well, no, they're not. These cats all had cystocentesis. This cat had a little tiny blood clot on that where the puncture came in, a little bit more irritated than I thought it might be. Look at the hole that was left here after the cystocentesis and a little bit of reaction around it. And again, a little bit of a blood clot somewhere in here was the cystocentesis. You have to be careful not to attribute a cystocentesis artifact as if it had pathology. Now, something that we did in the research environment, which I think can also be potentially revealing in the clinical environment too, is to examine the cat's bladder at low pressure, which is 5 centimeters of water pressure, and then again at high pressure. How do you do this? You just raise the bag up 5 centimeters over the cat's bladder, then you raise it 80 centimeters. This was taken from human medicine with people that were being evaluated for cystoscopy in the human sector with interstitial cystitis. So here's a cat that has some glomerulations at low pressure at 5 centimeters. There's a few of them, 1, 2, 3, 4 maybe, and not maybe a little bit of edema, but not much. And then we bring the bag up to 80 centimeters, and she pops out with all kinds of glomerulations. And so it's a provocative test for those that you're wondering whether or not did they really have interstitial cystitis. And now you can't see any of her blood vessels. Because why? Because those blood vessels are leaking and she's got edema inside her bladder wall, her parenchyma. So the question that I'd like to ask is, can cystoscopy actually treat interstitial cystitis? And there was a contention for a long time in people medicine that it could, and it's called therapeutic bladder hydrodistension, that if you fill the bladder up to a high enough pressure and leave it there for a few minutes, that you'll deplete the sensory neuropeptides in the bladder, and those patients might be helped. It's controversial. Some people consider it to be a mutilating procedure. Other people will consider it to be something to be considered when nothing else is working. Does it work in cats? I think it does in some instances. The very first cat I scoped was a female cat that belonged to our dean. The cat had had horrible cystitis for 9 months. And I sent the cat home and I never heard back from him. And I called him to see what was going on. He says, oh, the cat's normal. And I went, whoa, really? I had never heard of therapeutic hydrodistension. Simply distending the bladder for as long as we did for our procedure, because I was new at it, I think actually provided therapeutic bladder hydrodistension in that cat. And it happened in a couple other cats too along the way. I think this might be a good time to take another small break. And if anybody has questions.
Yeah, there are a couple questions here. I guess I have one first is, did the dean give you a raise since you cured his cat?
Listen, I was at Ohio State. You know the answer to that.
Yeah. One question is, can you do cystoscopy without general anesthesia?
You can, and I have done it in dogs. I've done it in dogs that were relatively moribund, that had tumors, and I gave them light tranquilization or light analgesia. I think it's a risk to your equipment, and it's a risk to the patient if they get painful. I don't like to do it.
Okay. So this is continuing on the line of the therapeutic hydrodistension. The question was, how long would you distend the bladder? and what pressures would you use? So can you tell us a little bit more about that technique?
Yeah, I think, I don't remember all the details, but I think it goes at 80 centimeters for 3 minutes.
Okay.
That's the way they did it in people. And some physicians really thought it was a great thing, and other physicians thought it was cruel and abominable because it stretches the bladder in a way, and it's painful until it's not, because then you deplete all the sensory nerve. The women that they did it in were not under full anesthesia.
Okay. And then how long should you wait to scope following a cystocentesis? Showing those lesions, they were pretty dramatic to me, at least.
Remember, the scope is magnifying that little lesion 10 to 100 times. Okay, so we never took any particular measures to avoid scoping near the cystocentesis. I actually did some cystocentesis while I was scoping. Okay. When we forgot to get a sample. So while there was still a little yellow color to the urine, we took some urine out for cultures. I don't think it leaks if you don't do it at high pressure.
Okay. And then one last question is, how did you treat the cat that you showed that had the urethral stricture?
The one that I did, the surgeons are very keen on planning a 3-hour surgery where they went in and did a plasty procedure where they removed part of the urethra and sewed it back together. I'm not a surgeon. I don't know exactly what they did, but it was a lot of replumbing. I wouldn't do that today. I would just pop open the hole.
Yeah, at least I've done several dogs with urethral strictures with just balloon dilation, and they did fairly well. So, okay, well,
I didn't know enough at that time to know about balloon dilatation. I was pretty freaked out about it, and the surgeons, of course, wanted to do the surgery.
Yeah. Okay, well, that's all the questions we have for now.
Okie doke. Moving on. So again, for reference, our normal bladder with small numbers of relatively straight vessels and no edema. And this is probably the worst case scenario on the right. We can't see any of the vessels because there's edema, and there's all these what are called glomerulations. Some human urologists called them glomerulations because he thought they looked like glomeruli. Of course, glomeruli do not belong in the bladder. But at any rate, they are submucosal petechiations, and it's not pathognomonic for interstitial cystitis, but it is frequently highly supportive. So here's a cat that had one glomerulation. You can see it looks like it's turning around off of a vessel here. If you only found one glomerulation, you would let it go. Usually interstitial cystitis cats, if they have glomerulations at all, have them in all 4 quadrants, and they usually have quite a number of them. This cat here on the right has quite a few of them. You can see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, clusters of them here. And it looks like there's an increase in the fine vascular pattern too, which is all part of the interstitial cystitis, sterile cystitis story. So what's interesting about this picture? Well, we've got a tortuous blood vessel here, and it comes in and out of focus. It looks like we have a couple little glomerulations here, but tortuosity of the vessels is a common thing that happens in interstitial cystitis, and edema. And we can see the blood vessels coming out, leaving our field and coming back into our field of view. Glomerulations can look very different from cat to cat, and these are 2 different cats here. You can see there's a small number of them here. This cat has a ton of them. Again, it's all supportive, and it only supports interstitial cystitis if you rule everything else out. You can't have stones, they can't have an infection, they can't have tumors. If they have just glomerulations and they don't have anything else, it's probably interstitial cystitis. Now, 90% of the cases have the non-ulcerative form of interstitial cystitis. About 10% have this kind, where they've had ulcers. This ulcer is healing. This has got blood clot adherent to an underlying ulcer. This is a highly ulcerated area with fibrin adhering to the ulcer. Another boxcar type of ulcer. You can see this one looks like, you can see the indentation in these 2 ulcers here. They're not as healed. and yet another cat that has blood adhered to the underlying ulcer. Only 10% of the cats with interstitial cystitis will have this form, excuse me, of the disease. Now, I've taught for many years that crystals are way overrated and don't usually cause disease, and that's usually true, but maybe not in this case. In these three cats, these crystals, which were struvite crystals, were highly adhered to the mucosa, which means that the mucosa is highly diseased. The gag layer isn't doing its thing, it's allowing stuff to stick to it. But I flushed vigorously through the scope and none of this stuff moved. I scraped it off a little bit with just the tip of the scope and it would come off, but it was really heavily adhered. You can see some of it has moved down here and there's a big wad of it here. This cat has a few glomerulations underneath some of the adherent crystals. So in this rare circumstance, crystals that are adhering to the bladder wall may actually hurt the cat. A cat that has interstitial cystitis and has a blood clot that was there as we came in. We did not create that blood clot with our scoping. This is a very nasty looking bladder. I'm going to show you a movie of it here in just a moment, but you can see numerous glomerulations. Some are small, some are bigger, but there's a ton of them and they're in all quadrants. I have it listed as screaming FIC because this cat screamed when it peed and it screamed before it peed. We eventually did help the cat. Let's see here. Oops, come back here. See if we can make this. Oh, I know. I can't make it play.
Hey, Dennis, I think you have to take your laser off and make it a pointer.
Yeah, I do, but I don't. Oh, wait a minute. Oh, here it is. Here it is. Thank you. Yeah, thanks. How do I do that? It doesn't give me an option. I hate to do this, but I'm gonna back out of this thing for a second.
Oh, there you go. There you go.
Did it work?
Yeah, you took it off.
Oh, okay. Okay, good. Can you see it okay now?
Yeah.
Okay, so here it is. It's a little dirty because I didn't clean the bladder out before I started filming. I was so excited by the glomerulations. Those little things there are lipid droplets. And at first I thought they might be stones, but they're floating to the top part of the bladder. This is the left side of the bladder. The right side of the bladder is on the downside. It would have been prettier if I had taken all the particulate material out. But I think you can see pretty nicely the glomerulations here. It's one of the nastiest set of glomerulations. I think it is the nastiest that I think I've ever seen. That's probably enough. Now, these three cats had interstitial cystitis, but they had something else funky that I was not expecting. And we don't normally think of the ureter or the kidney being much involved with cats that have interstitial cystitis, but all three of these cats had something coming out of their ureters. This one has a blood clot coming out. It's bleeding out of its ureter. This one has a plug. It looks like its struvite crystalline material is blowing out of the ureter. And this one has periureteral inflammation or hemorrhage. Excuse me. Uh-oh, let's see what happens now. Well, you made it through that. Okay. So here's another cat that had horrible interstitial cystitis. It had a very tiny bladder. It was a non-distensible bladder. And I scoped the cat in the urethra here, and I'm looking forward. And this thing here and beyond is the bladder. There's not much bladder there. Now, over a number of months of successful treatment for interstitial cystitis, the bladder volume was reclaimed. But right now, there's a very drastic, that is the bladder. That's it. There's not much of it in there. Here's an air bubble. The cat is again lying on its right side. Whoops, come back here. What happened? Air bubble on the upper left side just for orientation. I saw all this gold stuff when I was scoping this cat, and I thought it might be stones, but it floated to the top. And these are lipid droplets. Remember, the lipiduria is normal in the cat. And a higher powered view of that, I pushed the scope closer, quite a few of those lipid droplets. And more of the same. Underneath all those, the lipid is not pathologic. It doesn't create these things. There are some, you can see some variations around here also. Well, we don't need a scope to see these radio opaque stones, but sometimes we can take them out if they're not too big. This is an oxalate stone on the upper left. This is a struvite stone. You can see the erosion where it's been lying in the bladder. This is a linear stone. Linear stones are funky. They're vermiform. They oftentimes have suture in them. You can see an extruded suture piece coming out of the back of this thing. These are calcium oxalate stones that are embedded in a blood clot. And so they're hard to get out sometimes when you're hydropulsing, but we want to make sure we get them if we can. Extruded suture material, two different types of extrusions. I think this is actually a dog, and this is a cat. So, and anytime a suture extrudes, it leaves itself wide open to create urinary tract infections and for calculi to grow on the extruded material. So hopefully some of you are doing voiding urohydropulsion in cats, particularly if they have small stones, and especially in females. And I call it shake and bake. Dr. Lulich developed this many years ago. You hold the animal, the dog or the cat up straight upside up in vertical, and you shake them until their stones fall down into the outflow tract, and then you squeeze the bladder. I used to do this under anesthesia so we can get a bigger push on the bladder, and then we blow the stones into a container. These are stones that I hydropulsed. The reason I'm putting them in the scope talk here is because I looked up there with the scope first, and then I hydropulsed, and I looked back up there to make sure I got them all. And if I don't have them all, you hydropulse again. Otherwise, you have to do ultrasound, or you have to do some radiographs to make sure you got all of them. Surgeons do not like dealing with this kind of stuff, sandy, small stones. In cats, the female cat, you can get stones up to 5 millimeters. Male cats are a lot more challenging. This is actually from a male cat that I did. It had hundreds of small stones. I spent a long time trying to get these stones out, and you can see they're, and I didn't get them all out, and eventually did have to send the cat to surgery, but these vermiform things have suture in the middle of them. Anytime you see these linear types of stones, it usually means that there is a problem with extruded suture. If this is a female cat, these stones here are probably small enough that you would be able to hydroexpel them. They have to be small enough. So we can also do some biopsy techniques through the cystoscope, looking for trying to differentiate inflammation if there are masses versus cancer. This is a case that Felipe did recently. And the cat had bloody urine and was straining to urinate. And there was an ultrasound that showed a mass. And so he wanted to get in there and diagnose what it was. And you can see this frond-like thing. There are also mounds that are growing off. This is more protruding into the lumen. This is the more typical mound. Oops, come back here. And coming after it with the biopsy instrument, plucking that thing out of there, and after it, there's hemorrhage that you can see the big missing piece of tissue, which has been taken to submit for histopathology. Sometimes we do lithotripsy. We don't do it frequently in the cat, but we can. And if the stones are big enough and we want to break them up, so then we can hydroexpel them, or we can grab them with a basket. This is a colleague of mine, and this is our tech. Of course, you have to wear protective glasses, and yes, I looked a little bit different back then. And so we have the laser line that we're going to put through fiber optic through the cystoscope and put against the stones that we're going to attempt to break up. It's like playing Star Wars. You put your laser beam right on the stone, you activate the light, and the stones break up into pieces. And then you either grab them with a basket or you hydroexpel them if you make them small enough. And is this a movie? It is. Okay, let's do that. And here we have the Star Wars light on the stone, and you can see it's shattering. And the smaller the pieces, the better. If we can do that, you don't want to get too close to the mucosa. You don't want to zap the mucosa. It's fun to do this when you first start doing it. Some people like to do this. The novelty wore off on me. All the younger people like to do these zappings. So what are the things that could go wrong during your endoscopy? You could perforate something. I think I told you that I perforated the vagina once in a cat. I came close to perforating a urethra in a dog. I have ruptured a bladder in a cat that had 7 previous surgeries for stones, and we decided we would hydroexpel, and then we broke the bladder. These animals will frequently have microscopic hematuria. Maybe they'll have macroscopic hematuria for a day or so. It's possible they could acquire an infection. We try to be as clean as we can. If the scope is very large and you're dilating the urethra, they may have an incontinence for a few days or so. The most disconcerting thing is if you can't pass the scope, if the scope is too large, that you've got the animal under anesthesia, and it's very disappointing, excuse me, that you cannot get a decent view of what you want to take a look at. With the plethora of different size scopes that we have now, that is very uncommon. Now, this is in a dog, but the principle is the same. Here's the bladder up here, and you can see it's not a full thickness perforation, but here's mucosa, and here's submucosa here in the proximal urethra. Somebody pushed a little too much. This bladder broke in front of my very eyes while a surgeon grabbed the fluid bag and squeezed on it suddenly, and it blew the bladder up and it broke. It's never a good thing to see white cottony stuff on the other side of the bladder. That means you're looking at mesentery. Shouldn't have happened, and it shouldn't happen to you either. So things that can go wrong, if you don't distend the vestibule enough, you may not be able to identify the urethral orifice, and you might get lost. If the urethra is too small, you might not be able to get in there. In dogs, we get lost in the clitoral fossa. That's not a big deal. In cats, and we don't usually get lost in the vagina in the cat either. Perforation, unlikely. Scope-induced mucosal trauma with bleeding, yes. Acquired UTI, very, very uncommonly. We typically, forever, have put them on prophylactic antibiotics, which is looked down upon these days. And we usually put them on a little bit of analgesic for a day or so after the procedure. Excuse me. I'm coming down with a cold. So Dr. Weiss, who's the godfather of infectious diseases and the proper use of antibiotics, wrote something recently that anecdotally, bacterial cystitis doesn't seem to be a problem with or without this antibiotic prophylaxis. In human medicine, microbials should not be given to prevent urinary tract infection. A single dose of something before cystoscopy or immediately after cystoscopy did not reduce the risk of urinary tract infection or bacteria that were observed in the urine. A couple of years ago, I had my own cystoscopy, and right 15 minutes before my procedure, they made me take a ciprofloxacin pill. They washed and disinfected my entry area, and the urologist wore gloves, no mask or gown, nothing, and went ahead and proceeded. He was done within about 3 minutes. It's very important to be systematic and thorough, where you note both normal things and abnormal things. It's really a good idea to have a checklist if you can. And if you have a diagnosis, that you should commit to it. What is your endoscopic diagnosis? This is a form that I developed many years ago in FileMaker Pro. And we start with the urethra. What was the quality of the evaluation? Was it a good evaluation or wasn't it? How was the external urethral meatus? Vascularity, was it normal or was it high? Were there crystals or calculi? Were there erosions, diverticulums, any masses? And in the cat, probably we won't see ectopic ureteral openings, but in the dog for sure. What was the quality of your bladder experience? I mean, if it's all bloody, you might not be able to see too much. What was the vascularity? How severe was it? Where was it? Was there tortuosity? Was there a lot of debris? Was there hemorrhage? Did you have glomerulations at low pressure or high pressure? Sometimes we only see them in high pressure. Was there edema? Were there erosions? Did you find stones? Were there masses? Did you have flakes of gag? How was the friability? Was it exaggerated? Was there a see-through bladder? Did you find a diverticulum? We see that occasionally in the cat. We don't see ectopic ureters usually. Distensibility, sometimes the bladder is not distensible when it has chronic disease. Did you take any biopsies, and are there any further comments? And what is your cystoscopic diagnosis? Normal or cystitis or stones or tumor or strictures or something anatomically wrong? In males, it's a good idea to break it down into the penile urethra, the post-prostatic urethra, and the pre-prostatic urethra with the same types of things about vascularity, calculi, erosions, and masses, so we can get a little bit better idea where the lesions may actually be. And hopefully in this 50 minutes or so, 55 minutes that we've been dabbling in feline cystoscopy, I've given you a little bit of a flavor of what you might find. And for lesions, it's well within your wheelhouse. Once you've done a cat or two, you'll probably find out how simple it can be and how revealing it can be. Any other questions?
Yeah, we got a few questions here. One was, what would you do when you find old suture on cystoscopy?
Sometimes you can snip it if you can get to it. We've done that in the urethra when suture was being extruded. We took that suture and snipped it through the under the scopes of visualization. You can take the little scissors that go through the cystoscope, and you could at least cut it off at its base, but it still may continue to extrude. So it still could be a problem because you're probably not going to be able to get all the way down to that area. Ultimately, if it extrudes again, you're probably going to have to go to surgery.
Okay. Do you sometimes consider temporary stents after procedures like ballooning or lithotripsy?
Usually after lithotripsy, sometimes they're sore and they can be swollen. We usually leave a catheter in for a day or two, probably at least 12 hours afterwards if it was a brutal thing. If it was not so brutal, some of those animals are able to go home within a few hours. I've never put a stent in for that.
Okay. What are your thoughts on giving bupivacaine before finishing cystoscopy? It's a common practice. Is this a common practice for your cystoscopes?
It wasn't common for me, but it makes sense that it could be. I mean, there are some studies that show that bupivacaine can actually help you unblock a cat faster due to relieving spasms and that type of thing. I think it could be useful as long as you don't do it under pressure, so you don't force it into the circulation.
Okay. How do you obtain cystoscopic biopsy samples large enough to be diagnostic? Sometimes they're just too small.
That is true. And if you're using, sometimes what we end up doing is a semi-blind thing. If you're using a scope that has a sheath, we take the telescope out and then put the larger biopsy device through the sheath and go to where you think the lesion is going to be, if it's a generalized problem. If it's a mass, you can do it with ultrasound guidance. Just get the biopsy instrument into the urethra and then follow it with ultrasound and take your biopsies that way.
Okay. Do you have any recommendations regarding anesthetic drugs to relax the urethra to facilitate scoping, or drugs that we should avoid?
If they're under general anesthesia, you don't normally need any other kinds of drugs like prazosin or something to lower urethral tone. If it's a general anesthetic, their urethral tone is usually not an issue.
Okay. Will the bladder wall be injured and bleeding if you try to flush or scrape urolith crystals that embed in the wall?
Yeah, that happens occasionally, and I didn't actually show you some of those pictures. If they are embedded, you can actually cut over them with a blade through the cystoscope and expel them. But sometimes they're really hard to get out because they've been infiltrated by tissue growing around all different parts of that calculus. It can be a problem.
Okay. A question is how to stop excessive hemorrhage after biopsy, and maybe along that same lines, you showed that cat that had the FIC associated ulcers. Is there any specific thing you might do in regards to that and the ulceration?
Well, that's a whole nother hour about how you do stress reduction for cats and how you optimize their living spaces and reduce, you change their brains so that they are not activating all this inflammatory stuff and they get better.
Okay, one more question is, what type of laser do you recommend for lithotripsy?
I haven't seen some of the more recent things, but we use the Holium YAG laser.
Okay. Okay. I guess one final question is, what would be your recommendation as far as the place in line with cystoscopy compared to other advanced imaging? Would you have a tendency to go with cystoscopy first before you do, advanced imaging like CTs and things along that line?
For me, always, particularly for dogs that have incontinence. For dogs, I mean, it's the best thing there is going for ectopic ureters for females. And if you're good, you can still diagnose the ectopic ureters that way with in the male dogs too. For cats, I think I like it to make sure I haven't missed anything. And when I call it interstitial cystitis and they've been sick for a long time, is it really interstitial cystitis? So yeah, I would rather do that than if you've had plain radiographs and there's no radio opaque stone, I would scope them. I wouldn't be doing CTs and all that kind of stuff.
Okay, Dennis. Well, that finishes the questions. Thank you so much for your presentation. I think we rarely ever hear about cystoscopy in cats, and you've given us some good ideas of things that maybe we should do.
I think it's interesting that I never thought that people would really want to do them in cats. Everyone was excited to try to do them in dogs because they're bigger, that's a little bit easier, and dogs have more diseases that you can more readily get to. But having said that, there's still a lot of stuff you can do with a cat.
Yeah, very definitely. So again, thanks so much, and thanks to the audience for joining us. Our next scheduled endoscopy talks will be given by Dr. Bob White from the UK, and he will tell us about using the VTOM. It's a visualization system involving a telescope and a video system for teaching and in practice. I know our surgeons use this system all the time for their fine, delicate surgeries and in teaching our veterinary students. So this is one to watch. This is Wednesday, October 13th at 2 p.m. New York time. And we will look forward to seeing you then. In the meantime, we wish you all the very best of health. So thank you very much.